Good afternoon to colleagues and welcome to today's Spark session. My name's Alex Heritage. I'm the Chief of Strategy and Transformation here at Hampshire and the Isle of Wight Healthcare. Delighted to welcome you to this afternoon's session, especially to colleagues that may have recently joined our organisation, or if you are one of our partner organisations and you've been invited to attend today's Spark session, you are very welcome. I just wanted to quickly outline the format of our Spark session before we get into the main event. For those of you that may not have attended previously, this is our second Spark session where we have a focus on things connected with strategy and transformation, ideally looking for creative thinking that will link to meaningful action in our organisation and across the communities of Hampshire and the Isle of Wight. This is our second session. Thank you to those that joined our first session and the feedback that we got. Based upon your feedback, we slightly extended today's session. Really positive feedback, but there definitely was a theme, which was we wanted some more time for questions. So today's session, we will have a presentation and that will be followed by some space for questions and answers. And if you are willing and able to use our chat function or to use the virtual hand, that would be fantastic. We will make it as accessible for colleagues as possible. This session will be recorded, it will be edited and it will be circulated. So if you don't want your question or indeed anything not shared, please just indicate either during the session or afterwards. I would like just to again remind colleagues to mute your microphones if you're not speaking, and just to underline that today's session, as ever, we would like to be guided by our organisational values. So this is a really interesting topic, but we just want to make sure that our values are always at the heart of what we do. So I'm delighted today to welcome our speaker, Dr Alec Price-Forbes, who is the National Chief Clinical Information Officer. He will be guiding us through a really exciting topic. It's probably one of the biggest areas, not just in health and care, but probably in every industry across the country, if not globally at the moment. I did just want to underline that obviously having a speaker from the national team means we just have to be mindful that we currently are within our election purdah. So it may be that you have a burning question to ask at the session, but please just be mindful that there may be some areas that Alec is unable to answer because of the purdah situation. So that's enough from me. So without further ado, I will hand over to our main speaker, hopefully is somewhere on the screen.
Thank you. Good afternoon, Alex. Thank you for the introduction. Can you hear me okay? Fantastic. Next check. So thank you, Alex. Thank you, Simon, for the invite. Lovely to be here. I'm going to present a few slides and then really open it up to a Q&A. I think that's where we get the richness of conversation and really bring in to bear what your positive ambitions are, what your concerns are, how we do this together. And I'll sort of get to more of that as we go through. Can I just make sure I'm sharing hopefully the right slide deck? It would be somewhat embarrassing if it was wrong. Let me know when you can see something as it
we can see Alec
in the background. I can't see it yet. Right, can you see something?
Yes.
Fantastic. I'm not going to use all these slides, but I'm going to flit through a few. So thank you, Alex. As you said, thank you for the invite. I am a consultant rheumatologist by background. I still practice clinically, normally on a Monday, face-to-face and virtually, but this week, because of NHS England pressures, I was in London on Monday, so I did my evening virtual clinic last night. So I speak to you as a fellow clinician, for those of you who are clinical on this call, and I have the privilege, but also the challenge of treating real patients, but also when I say the challenge, it's the challenge of using a lot of the technology that we've invested in over the years. So I'm going to share a glimpse really of where I see the future heading, if you will. We know that we have some challenges, okay? For the NHS to be fit for the future, we've got to accelerate bold transformation for the NHS, making digital by default a catalyst for sustainable system-wide change. It's fair to say the public's needs and expectations of the NHS and the patient demand have outpaced really the 20th century healthcare model that we currently have. Spending has increased. Productivity has plummeted despite a 30% increase in the workforce over the last 15 years. Waiting lists have soared. But more critical than anything is the worsening outcomes and lived experience for individuals, for families, communities, and wider society. And let's be honest, we are living in really challenged times, both from a national and geopolitical perspective. We've got to fundamentally change the relationship between the NHS and individuals, empower all of us and people to take charge of their health, expand choice, reduce waiting times, work effectively across government departments and with our communities, and really importantly with our VCSE colleagues, to address those all-important wider social determinants and improve outcomes and life expectancy. And we know really that healthy life expectancy has been lagging behind average life expectancy, particularly driven by dementia, cardiovascular disease, and respiratory disease. So there are some challenges. Now, the most expensive commodity in healthcare, dare I say, I've got one here, but I try not to use it, is a doctor and a pen. And what we need to do, if we're going to really abide by the shifts and the 3 shifts, but particularly the analog to digital shift, which I'll talk about more in a minute. I don't like that phrase, analog to digital, but that's my personal challenge. I think it's fair to say that, unfortunately, the NHS in essence remains an analog service that was built, as I said, for the 20th century. To put it another way, it's Blockbuster in the age of Netflix and Apple TV. And unless it reforms, it's going to go the same way as Blockbuster. The NHS still holds enormous public trust. We've got amazing staff. All of you and lots across the service are delivering life-saving care on a daily basis. But like Blockbuster, legacy alone isn't enough. Reform isn't just about survival, it's about relevance. So the choice before us today is either to radically change the model of healthcare that we currently have, or, to be frank, lose our health service as we know it. Now, the greatest opportunity we have is the potential to safely harness the power of the technology revolution that has fundamentally transformed our everyday lives. Steve Jobs, relevant as the CEO of Apple changing, was announced this week, but Steve Jobs historically really did transform our lives before we knew it. So how do we do that from a healthcare perspective to meet these challenges, to improve health, provide safer, higher quality, sustainable care for all? And I want to share with you this phrase and just allow you for a moment to read that phrase. You will all recognise this because I know you've all read the 10-year plan from cover to cover, and this is page 38. I'll test some of you later on other pages and content, but this sentence has enormous implications. Care that by default take place digitally, not tethered to a physical location, not requiring a patient to attend an in-person setting unless they want to or whether it's clinically necessary. That sentence implies a phenomenal change to our current business model. And you've already seen that with confirmation of the movement towards delivering the NHS online, which will go live and be seeing patients next year. So rather than embed digital tools into traditional services and pathways, we see a fundamental reimagining of how care can be designed, delivered, and experienced to empower patients to own and co-manage their own health. I think and that really shifts towards me wanting us to deliver the quintuple aim. I know we've got the 3 shifts of the 10-year plan, but we've known about the triple aim of healthcare in terms of improving health and well-being at a population level, improving the experience of care and the quality of care at the point of need at a sustainable cost. That triple aim has been around for decades. Improving staff experience and outcomes came into being in 2014. That created the quadruple aim. And then really with the pandemic, it was about addressing inequalities and enhancing health equity. So we've known this for quite a while. And our medium-term planning guidance and framework has reinforced the most ambitious plan really in a generation, designed to reset the foundations of the NHS, support local teams to deliver the strategic shifts set out in the 10-year plan. And at the heart of that is a clear principle to be digital by default. So what do we mean by that? Well, it's not, being digital by default isn't about replacing human care. It's about freeing up our staff to actually focus on those that actually need care in person. So by fully harnessing technology, digital tools and data, and of course the burgeoning area of AI, we can close the gap between demand and capacity, improve patient experience, reduce friction in pathways, support staff and improve productivity. So I think this diagram sort of shows that layering effect that historically 95% of care has been in the green bucket at the bottom. It's been in-person care. But there's an opportunity really to move towards a digital by default to enable those that can to autonomously or self-serve their own care, but really support digitally enabled care in different ways. Recognise there'll be lots of patients who still need hybrid care and those that need in-person care, but it's probably an 80-20 rule. And that frees up staff to support those. Particularly, we want digital to be inclusive by design, but this does help support the workforce, supporting those that can't. So I think technology has the potential to restore the art of medicine, focusing on holistic, person-centered care. But technology development alone is not enough. It only delivers value when fully embedded properly. And so our future success hinges on really mainstreaming a practice technology adoption blueprint. And this next slide really focuses on that we want to drive quality, we want to drive improved experience, we want to drive productivity and service improvements aligned to the reform strategies, which I'll talk about in a bit. But the funding, productivity, all of that the three shifts is all well and good. The fourth bucket here, benefits realization, is the real key point. We have invested as a health system billions of pounds over the past 10-15 years on healthcare technology, but we've not invested in our people. We've put technology in, we've implemented technology that has varying functionality and usability. We haven't really invested in change management and behavioral science, and we've not invested in a really standardized approach to adoption and benefits realization. So we've now got to have a systematic approach to how we blueprint business change and implementation. So for me, the implementation will be equivalent to benefits realized. We won't just put tech in, we've got to invest in people, and that's got to be with all of you. That implementation and strategic delivery needs to take place in localities at place at provider. So people hold the key, and I probably said up front, well, if I haven't, I'll say now. We start with people. I'm going to sandwich a bit of digital data tech in the middle, and then we'll end with people as well. But people hold the key. We need to equip all of the workforce with the right tools and skills to drive an outcome in a standardized, repeatable and consistent way. And that's going to require us really supporting staff, redesigning pathways, measuring impact, ensuring organizations have the appropriate capability and leadership to drive meaningful change. We know digital maturity aligned with embedded improvement methodologies and behavioral science is already delivering up to 13% greater efficiency in the most advanced trusts. So it shows what's possible when we get this right, but we've got so much to do. And I think there's going to be a real focus from my perspective, from a clinical leading perspective, working with the regions and systems and providers on focusing on how we can go further with technologies, but really focus on implementation, adoption, scale, and that change management to really reimagine healthcare as we know it. Ambient voice technology, as I'll allude to shortly, is one of those most exciting and transformative innovations in healthcare. And I think there's a real opportunity to enable that consistent reduction in documentation burden, in improved quality and structure of clinical records, and other aspects. So I think this is all really, really positive as we move forward. So just to give you a sort of picture of how this all fits together, starting from the top, we have a clear mandate, a North Star really from the 10-year plan. We've got major transformation deliverables that fit across the strategic drivers of these three shifts. We know somebody's done the statistics that 49% of the 10-year plan is enabled by digital data and technology. I would say people are the key. And actually, digital age technology is the golden thread that fits across all of it, because we can't live our lives without digital data technology. The question is how we're going to now layer, not retrofit, but purposefully, strategically design the AI potential that we have to deliver that objective that's there in blue: better patient experience, higher quality care enabled by higher productivity. We've got some key transformational programs within NHS England aligned to core infrastructure. Some of those are focused on transforming the patient experience through the NHS app, transforming connecting care through the single patient record, etc. But we've got to be innovating and researching and evaluating as we go along and look at secondary use of data. And what that means for patients and staff will be more personalised care, better engagement, more empowerment and activation, but better workforce process automation and augmentation where it's appropriate. And I've just, on the next slide, I've just layered over some of the sort of priorities and digital and data core capabilities. And I'll talk a bit more about these, but you can see some of those from NHS app and patient portals, single patient record, AI triage, AVT, etc., EPRs, GPIT, all of these being really important, but being enabled. Digital data technology, as I've said, in and of its own is not going to deliver the change we need. It's people. So we need really strong leadership, decision making, good governance and assurance, and that transformational change management approach, and making sure we equip digital skills and inclusion at the heart of all of this. I know this is just showing an alignment really of, we've got those 8 business cases on the left-hand side, but we've got some really key reform plans that I've mentioned, reform strategies around urgent and emergency care recovery, elective recovery, sprint reducing waiting lists, improving access to primary care, and that's part of the UEC recovery plan, how model neighbourhood works, and the dentistry plan with a view of looking at mental health as well. And underneath that, you can see what I've referred to as modern service frameworks. Serious and enduring mental illness, cardiovascular disease, sepsis, frailty, cancer. Sepsis is going through the National Quality Board at the moment for subsequent publication after the local election period. And I think what we are saying is that all of these reform strategies depend on the technology capability and planning that we're creating, but we need business ownership and partnering, because it's not about digital data and tech, it's about people and the use of those solutions that enable us to be more tech-enabled, but clinically, operationally and business-led, but focused on our customer, our people. So we think the MSFs are a really good opportunity to reform individual care areas at a level of depth to embed digitally enabled transformation, and that's really where focuses are going to come. Probably something to employ in the Q&A, but we are planning some workshops looking at serious and enduring mental illness and trying to look at a blueprint for how we can create a modern service framework where we describe the capabilities and functional requirements of the core care processes that clinicians, health and care professionals in any care setting undertake, but also that our patients, our customers need to be able to navigate. And how do we start to describe those core care processes enabled by functional capability within a technology stack? And what's the opportunity then for AI either to augment or fundamentally replace some of the existing technologies? And this next slide just again is just advancing what I've already mentioned around how we, and Simon Jones on the call will recognise this slide, but I'm repurposing it. How do we look at these capabilities? And this is not exhaustive, but from looking at a PHM perspective through to the individual customer perspective, the NHS app, workforce tools, single patient record, EPRs, etc. How do we start to leverage the benefits of that? But as I've already alluded to, we've got to have people, good assurance, decision making, leadership, good governance at the heart of everything we do. So we need to be bold. We need to be transformative. We need to think future, and we need to think patient. And I was just sharing, just to stimulate maybe for the conversation, some really interesting. We had a workshop, and a major global company, shared some perspectives of North Star examples. So we've got our North Star really in the 10-year plan and what I allude to as the quintuple aim of healthcare. But I think it's really interesting when you start looking at some of these examples here, and particularly Netflix. Netflix started out as Postflix, sending out videos, if you remember, if those can remember that, and VHS, etc. But it didn't call itself Postflix, it was Netflix. So it's something about forward back transformation. How do we start to look at where we need to be in 2030, 2035? This will sound familiar again to Simon. We did this work 4 or 5 years ago. He will remember well, but it's something we don't do very well in the NHS. We tend to focus on the here and now because of the operational pressures we're under, and we then just try and leverage some new technologies and sort of retrofit. That isn't going to cut it. We've got to do this differently going forward, and we have to do it together. So we need to rapidly harness the benefits of these capabilities to provide a better connected, efficient health service. But we need to focus on improving the customer experience, quality and outcomes, as well as improving the workforce well-being and reward. It's still an amazingly privileged place to work in the NHS, isn't it? Doing what we do, but it's, boy, is it challenging at the moment. So how do we make that easier for all of our workforce? So that shift I've sort of mentioned, but really just highlighting the themes here. Again, I can share this particular slide, but being person focused, digital first access, being data driven, evidence based, making sure we've got connected interoperable systems and looking for the opportunities to free up resources by smart automation to maximize time for care is going to be really key. And we've got the luxury really of spending a sort of investment profile that's come from government and from Treasury that looks up the next 4 years, and that's a luxury position. So we've got a real generational opportunity, and for that period of the spending review, which is through from 26-27 through to the end of this Parliament term, there are 5 strategic themes that have come out around personalised prevention using the NHS app as a self-companion, how we enable customers, patients to be able to access, triage and navigate through the health and care complexity, through the landscape using the NHS app, how we can create almost a health companion for promoting good health and well-being through the NHS app for patients, how we can transform care pathways, and how we can really start to focus on community, neighbourhood, at-home care where it's pertinent and preferred. And the enabling themes really of getting our core infrastructure right. We know that 73% of people spend time searching for information and documenting information. We know that only 19% of the workforce say they have the right information at their fingertips to deliver care in an interoperable world. We know that people have challenges with single sign-on, multiple logins, etc. So we've got to fix all of that stuff. Information governance, business change, as I've alluded to already, really create the environment for all of us to be really strong clinical leaders and really shape the market if we're to deliver the ambitions that we've got. So some of the core capabilities I've already mentioned, but NHS app, trying to connect the NHS to create a single view, both for the customer, patient, as well as for the workforce, enabling data-driven decision-making and really looking at how we then evaluate and research everything we're doing in a really strong way. Just a couple of slides to share regarding where the NHS app is at. Just really by way of background, some of you may not realise, so I've got a team of 150 within my digital clinical informatics who provide all of the content and subject matter expertise, clinical safety, governance assurance around our live services. So NHS England produces 300 live services. 16 of those are critical to national infrastructure. Some of those, for example, the 111909 pathways are triaging 2.5 million patients every month. We have 44 billion messages being sent every month. There's 85 million hits on the nhs.uk website each month, where there are 2,000 topics that cover the entirety of health and care. So these are enormous things just sharing with you, but there's huge amounts that's happening. How do we start to do more and make it better? There's been good progress with the NHS app. Our ambition really is framed around three things: delivering the ability to for patients to manage their own health, enabling them to access primary care at a time that's convenient for them, and transforming their planned care so they know who they should be seeing, where they should be seeing, with really digitized elective pathways where appropriate. But universal adoption would drive further benefits. So it's fantastic that there's 44 million people using the NHS app. There's 7 million repeat prescription requests every month, but that's out of a total of 21 million repeat prescription requests. So we're only at a third, for example. That just gives you a flavour of how we really need to be changing the dial to improve the functionality and usability of the app, but also get more people doing it. So this is not just about getting the workforce to change as we implement new technologies, but also looking at the public and patients alike to really journey on this together. And our vision is, for the NHS app to be a companion that makes it easier for people to access the NHS, but also makes it easier for them to self-care and be able to do things that they require to do to live healthier lives. Just on that note, intelligent navigation and triage. So AI-enabled triage, lots of pilots happening at the moment where we can leverage the ability for free text comments to be structured so that somebody says this and then that, and it triages them to the appropriate service or information. I will allude to that ambient voice technologies embedded into the NHS app will transform this experience, and that's something we have as an ambition if we're going to try and move forward and actually really reimagine how we're delivering healthcare. So we're moving from the left to the right. That's the shift really we need to be making over the next 3 years, I would say. It's not really a 10-year plan. We've got 3 years where we've got the spending review money, and this is a once in a generation opportunity to do something really different. And this is just displaying really what it would look like from the point of view of managing health, managing care, managing by proxy your children, carer, as a companion, accessing your GP, managing your medicines, requesting your vaccinations, through to specialist consult and everything in between. There's going to be a way of doing this that we've got to fundamentally reimagine, and that's going to be really super exciting. I'm going to flip now slightly to AI. So just really to mention the Health Foundation's attitudes to technology and AI in healthcare. Some findings that were published a short while ago from the 2025 survey make for really interesting reading on both staff and public perception. Not all staff currently support the use of AI, although there's stronger sort of support in back office function than in direct care. It's fair to say that the public remain cautious but optimistic, and there's particular prevalence around ensuring that humans remain in the loop. And I'll come back to that really on the ABT conversation, but I think this is all potentially exciting, but it's demonstrating more work to do. We've been working on an AI roadmap, a roadmap that uses sort of McKinsey's 3 Horizon model, bringing together initiatives across arm's length bodies around the products being produced, setting out why we're doing it and when they will be live and who will use them. And these 6 pillars, if you will, articulate the sort of building blocks that we need to be able to work together. And that's really creating good, strong governance, right digital foundations, robust evidence, smart procurement, a skilled workforce, and effective partnerships. And this is what's going to enable safe, consistent, replicable, but accountable adoption across the system. So I think really important in that sort of whole AI governance piece. On the AI journey, I think it's fair to say that efficiency and productivity are an important milestone, but growth and innovation are going to be destinations. We've got to transform the operating model. And before just let people digest some of this, something really key. This is an overview of some of the key ambitions and areas within the 10-year plan. So it's covering quite a breadth. You can see where AI is going to be really important. Automating, improving repetitive tasks can yield a quick win, but we need to capture the potential of the shift from AI assistance to agentic AI. In short, we need to create time to care for human beings to be able to have that humanistic and bring more humanity to how we provide care. And then something about, for me, AI, productivity focused AI will definitely reduce cost. that innovation-focused AI will generate value and revenue. And there's something about how products, platforms, people, processes need to operate in a mutually beneficial feedback loop where you suddenly get a flywheel effect and you can suddenly spin off and create both an innovative profile but also value creation, and that value creation will then further propagate, and that's where we need to get a flywheel effect where we're supporting each other, getting the best of how we're using digital data technology but specifically AI to really reimagine processes and get platforms, processes and people working in a really synergistic way. So I think that is really exciting. Lots here about, obviously, the government are positioning the health service to be the most AI-enabled health service in the world. We've got lots on the roadmap, and there's going to be a big focus, I think, in the coming year or two around certain AI applications, particularly AVT and AI being just two of those. And this is just describing that, but there's others: AI-assisted discharge summaries, dermatology, diagnostics, particularly looking at radiology. I've not even put in here, in terms of medicines, both discovery, drug development, medicines discovery, etc., all really key from an AI perspective. And just really a plug for the AI Ambassadors Network. So the AI portfolio, the joint digital policy unit between Department of Health and NHS England, sit under my clinical leadership, and they've done an amazing job over the last couple of years, really going from a standing still to over 14,000 now in the Ambassadors Network. So please use that QR code. Please do join to contribute if you're interested. They're a huge repository of information and knowledge, and we've got some amazing people. Just really want to come back to AVT. I think we've been examining the portfolio. There'll be more announcements of this, as I've said, after the local elections, more broadly about where the sort of the direction of travel. But I think it's fair to say that ambient voice technologies has been considered one of the highest confidence areas to accelerate, that we know that it enhances patient experience and workforce experience. Lots of people tell me that for the first time in a year, either from shift-based services or from outpatient clinics, people aren't doing as much pajama time, and they're actually leaving their clinic or their shift on time. And we can't underestimate that patient experience and that workforce experience perspective. Productivity is a focus that, obviously, if we are reducing that administrative burden, there is an opportunity, there's no doubt, to actually to see more patients. I think that's particularly relevant from the evidence to shift-based services. So looking at call centres, 999, 111 pathways, ambulance, ED, obvious targets where there's anything between 13 and 15% reduction in time spent. But we've got to be aligning that to the reform strategies I mentioned of urgent and emergency care and access, selective recovery, and dentistry, mental health, and neighbourhoods, and looking at how we are absolutely moving towards clinical quality. I tell my team a lot, and continues to labour the point, that our North Star should not just be going from analog to digital. Our North Star should be, how do we align to the three pillars of the new National Quality Board? And quality is defined by three pillars of safety, effectiveness or impact, and experience. So every consultation, every touch point with a patient should be safe, using safe, assured solutions, but it should be enhancing their experience, both for the workforce and the person receiving care, and it should be being done to actually get the best possible outcome for that person. So something really important about focusing on that North Star. You'll be aware we've been doing quite a lot of work from guidance published last year and work with the MHRA. A note I put out just over a year ago around making sure you use safe, assured solutions through a rejig of the guidance earlier this year in the National Registry that now has 23 suppliers on. There'll be more coming around that. I just want to, this is probably the most important slide I'm going to give you, actually, in some respects, and that's to say, everybody's talking about AVT. Everyone has three-letter acronyms, from EPR to AVT to SPR. We're drowning in them, but I'm not sure that everybody appreciates that not all EPRs are equal. Not all ambient voice technologies are equal. We're not necessarily comparing apples and apples. So this slide is just to demonstrate that we're moving from a world where we've historically dictated. I'm at home, but you can see if I can just stretch it out, it's plugged in, my dictaphone. We've gone from analog voice files to digital voice files to voice to text. We're now moving into this exciting area of ambient voice. But as we move from phase 0 to phase 3, the important point is most of the AVT pilots have been around phase 1 or 1A at most. Where we want to go is phase 2 or 3. There's nothing innovative about me seeing a patient after 9 months who's already been to their GP 6 times, and they've been to A&E 4 times, and they've been to 3 other specialties in the hospital who then say you need to see a rheumatologist because they've got a complex multi-system autoimmune disease, and I see them after 9 months. Nothing innovative about me looking at 13 summaries, when in fact the story from the patient is the same. What will be innovative is how do we embed this within the NHS app to enable customers and patients to be able to tell their story once, and we capture structured high quality data that's then repurposed and moves through the health and care system for the point of care, so that by the time they see a specialist, actually we're just finessing and adding to the history, we're not repeating it. The second is, the biggest challenge for me personally when I'm delivering care is the requesting and the prescribing that I have to do in the electronic patient record system after I've done my letter. And that can take for a new patient anywhere between 7 and 14 minutes. On average, it's 10. I've timed it. I've done a study on it. That 10 minutes of requesting stuff and prescribing stuff is where we see phase 2, the automated workflow and advanced decision support. And this slide really starts to show that in more granular detail in terms of phase 2 there, drafting referral letters, communications, prescribing and ordering, drafting discharge summaries, follow-up actions, etc. A lot of work at the moment around the FDPA discharge summaries, but if we get AVT right, this will be the point of contact for discharge summaries, treatment selection, prescribing. And you can see as you go from left to right, from phase 0 to phase 3, that increasing maturity functionality will lead to better benefits. That's really where we see AVT going. The final few slides I'm just throwing in just to promote conversation. I'm going to stop actually really rapidly. First, velocity. There's a speed to this now in terms of pace of adoption, and we've never really adopted at scale in the NHS. We now need to do that so that we can really start to deliver the 10-year plan on North Star, but address the challenges and concerns around vulnerability. How do we start to look at the governance, ethics and assurance around the use of AI, because it is really exciting. The fastest adopted technology in history, a lot is moving faster than we can possibly ever go align to. So when you look at Netflix, it took 10 years to get 100 million users. For Instagram, it took 2.5 years. And now you look at ChatGPT and where it's got to. Things are moving at a considerable pace, and we're trying to keep up. So we need to be thoughtful, responsible, ensure we're using trustworthy solutions, but also purposefully redesign in a strategic way, and recognize the difference between generative, being an assistant, through to predictive, and the agentic world that we're potentially moving into. I'm acutely aware of time. There's a couple of slides. I'm throwing these in because it was shared with me yesterday. I'm just going to go to it just to illustrate a point. Bear with me. Can I ask anybody on the call the AI dilemma? You are faced to imagine a train travelling down a track towards 5 people. You're at a signal box. If you pull the lever to switch the points, the train will divert to a side track where there is only 1 person. By a show of hands, don't overthink it, who in the room pulls the lever to save the 5 people for the sake of 1? Quick show of hands? Or just an emoji? Yeah, well, there's a few. Gosh, I'm slightly worried. 3 hands. I'm hoping there's more, but gives lots of thumbs up. Anyway, this is what AI determined. This was just sort of looked, but 5 of our 7 AIs would pull the lever and sacrifice 1 person. But Gemini and Copilot decided not to pull. I think that's telling us something, that everything we do should be safe, assured, and deliver value. I'm going to wrap up now, but I'm going to come back to a very odd bit. I'm coming back to people. So my alternative profession was as a violinist. I was told to keep music as a hobby and go and do medicine because I could keep music as a hobby. They lied. I was having lessons at one of the London schools of music. I used to lead and co-lead orchestras. I now, having been forced by my wife during the pandemic, have rejoined after 30 years playing my violin and joined an orchestra. And I sit at the back. Gives a really good perspective on how people come together with a single purpose to deliver a really good outcome for the audience, in this case, playing music. It's really important. And I have a different perspective sitting at the back of the violins. I would, Alex, if I could see enough people, ask, in fact, somebody shout out, please, let's make this interactive. We want things to be standardized, repeatable, and consistent. So tell me, did anybody see Coldplay's tour last summer? And if they did, I want you just to shout out one word. Ian, come on in. One word to describe Coldplay.
Unbelievable.
Unbelievable. Okay, wouldn't it be unbelievable if every touch point a patient has with health and care was described in that way as an experience? That has got to be our North Star. Because, ladies and gentlemen, this is about how we start to restore person-centered care. At one level, healthcare is an enormous business where we're strapped to have to, have the modern operational efficiency of a plant, and yet it's about the hand-holding gentility of the parish priest. It's all about science, and yet it's all about what I call the art of medicine, or in this case, it's possibly the heart of medicine, with AI at the heart. And it's exquisitely human endeavor where we're privileged. So let's get people back. We've got a real opportunity ahead of us, once in a generation opportunity to leverage all that's good about digital data, technology, and AI, but keeping people at the heart of what we do. Thanks very much.
Thank you, Alec. An unbelievable amount of information to cover and share with us. So on behalf of the organisation, thank you. I'm sure colleagues will have picked up on numerous occasions your focus on people, your focus on service users and patients, which again came through really strongly. Colleagues may have thought it was going to be a technical lecture on AI, but again, to summarise at the end is lovely. We are cantering towards 2 o'clock, and there is a couple of asks of our colleagues here at Hampshire Isle of Wight. So I think, Alec, if you're comfortable, maybe if a colleague has got a burning question, we've had some wonderful questions in the chat, covered all the topics I expected, but either I can select one, or if we've got somebody that's willing to ask directly, I think maybe one question is probably all we've got time for at the moment.
I'm happy to answer one or take it offline. I'm happy also, can I just say, this is about engagement. I don't want this just to be a 1 point of me coming. This was a bit of a broadcast. I was trying to give you a picture of where we're going. Alex, maybe this needs a follow-up because we've got to do this together, and therefore for me, we are trying actively to engage with regions and systems, because that's going to be the only way to realise. But it's important that you get a headline of where we're heading, so we can then start to look at what does that mean, what's the capability, capacity of resources that we need in what setting to be able to deliver this. So let's think about the follow-up.
Brilliant.
But well, Suzanne put that hand up if you want.
Yeah, Suzanne is our lead governor, Alec, who is off the horse and cart and into a car from the chat. So Suzanne, are you happy to ask your question?
Yes, I am. And this is a bit of a hobby horse of mine, but what I actually want is exactly how far are we from a single electronic patient record that can be accessed by all GPs, all practices, and all patients?
I'll have to come back to you on that one. There is I say this is I've been in this game for 20 years. I'm 20 years as a consultant. I've been trying to do this for 20 years. Simon Jones on this call will know that I led a big vision in Coventry and Warwickshire for a single record 10 years ago. And here we are in 2026. Lots of work going on around the single patient record. It's a government priority. And we need to be delivering that within this Parliament term. Some of the other stuff I've talked about is here and now. The single patient record is a bigger construct. I actually believe the answer is, if we get an agentic architecture right, we'll be able to surface information and data from the NHS app, from different record systems, and present it at the point of care. That is already happening globally. So you won't log into a system, you'll log into a functionality data layer to get technical about it. So the technology exists. We're moving at pace. I may need to come back to you on that in a few months' time.
Thank you.
Thanks, Suzanne. So just as we have got probably time for one more question, if there's anybody that would just like to take the benefit. Appreciate what you've offered, Alec, in terms of us following up. Absolutely, we will. So, Johanna, would you like to come in?
You're on mute.
Thank you. I'm very excited, is what I'm saying. So excited I've got to take myself off mute. What I'm really concerned with at the moment is we're not just a health service. We're working in communities and neighbourhoods, and most of our partners, particularly, I'm a children's therapist, clinical lead. Most of our work is done with partners that are not health providers. How do we ensure that so there are different needs within that system? How do we make sure that we keep that at the forefront of our thinking, particularly with the other shift from hospital to community and more services become like us?
The short version is I 100% agree. I've still dealing with my mother-in-law who's in a nursing home with end-stage dementia. My mum was in a nursing home for 6 years with end-stage dementia and died 18 months ago. And I was privileged and humbled by the amazing work that the care sector, the voluntary sector, and other agencies do to keep people out of hospital. So I absolutely agree, and that is absolutely front and centre of our thinking. And that's got to be about what neighbourhood is all about. It's not about hospital. It is about hospital staff. I'm stood here. I do a video clinic last night with patients in Stratford-on-Avon. I'm seeing patients within the community I live in. When I'm in the hospital or in the morning, I'm seeing people in a hospital. So we've got to be clear about what that means in terms of people, but actually in terms of bringing people together, really important. We've got to stop pulling people out of the river of disease and prevent them falling in, but we've got to focus on wider social determinants, and that requires non-clinical colleagues working in those other sectors. Completely agree.
Brilliant. Thank you to colleagues that are brave enough to ask the question directly, and there are some questions that we'll pick up. I can see that some of our internal team are answering them. So before we finish, we did want to also take the opportunity just to launch something today. So I'm hoping with the help of our wonderful comms team, they might be able to just share a slide.
Yeah, bear with. There we go. Hopefully you can see that.
Thank you very much. Now, I hope colleagues will quite clearly see the linkages with today's presentation to what we are launching today. So today, myself, Simon Jones, who's our Director of Digital and AI, and Sinead Simmons, who's our Chief Clinical Nursing Information Officer, would like to draw attention to Think AI. So Think AI is going to build upon some of the pilots that I know a number of you have been working on. So through the last year, we have been trialling ambient voice technology. We have been working on our future electronic patient record, and we have been looking at other digital data and technology transformations. What's become clear in conversations is there is an awful lot of interest in artificial intelligence. So we would like to have a coordinated approach, and we want to bring as many people together as possible, and we'd like that to be a safe space. This will be for clinicians, operational colleagues, anybody in the trust, including our service users, our advocates, and our partners. So this is a chance for you to voice concerns, ask questions, and be involved in the next phase of our AI framework. If I just click on to the next slide. Essentially, what we would like to do is ensure that we continue, and as you've heard from Alec today, that we have a safe and effective approach, but we harness everything that's out there. So we want to understand where we could use artificial intelligence, and we want to ensure that we continue to do that within our governance, our standards, and our framework, so that we do have that standardized, repeatable, and consistent approach. And ultimately, what we've learned over the last year when we've looked at ambient voice technology is it's our colleagues out in our communities, our neighbourhoods, that know best. And we are not immune. I saw a comment, I was expecting it, that I get really excited about the future of artificial intelligence, but sometimes we're letting you down, that your batteries don't last and you can't get any signal. So there are absolutely clear things that we are focusing on, but at the same time, we must harness what we've got. So if I go on to the next slide, if this is going to interest you, we will invite you to be part of the AI task force. And look at that, when technology works, it's brilliant. In the chat, the link has just appeared. So to support Think AI, we are gathering together colleagues under an AI task force. This is voluntary, so we would like you to do it either as part of your role or around your role if you're interested. And this will give you the opportunity to guide our future framework around artificial intelligence. So this will be the space where you can share your views, you can build upon what we've done already, but importantly, you can bring forward things that matter most to you. So we are saying here, if you have skills and experience, but actually, if you are just interested, or do you know what, if you are highly skeptical and you want to share that, please do get involved. If you have a particular experience in research, innovation, ethics, user experience, etc., we would love you to be part of the AI task force. You heard from Alec. I know a number of you are part of the National AI Ambassadors Network. This is our version here in Hampshire and Isle of Wight. So you can see in the chat bar, there is a link there. If you want to be involved, you can be. If you just want to share your view, my final slide. As it clicks on, there is also a form that you can complete, which also will be in the access as well. There we go, it's just landed. So if you are interested in AI, but you don't want to be part of the task force, but you want to share your experience, please do complete the form, or indeed make yourself known. Come and have a conversation with myself or Simon or Shanez. We will do our utmost to make that a diverse group of colleagues. We recognise the feedback that we've had, but also the fantastic opportunities that the 10-year plan sets out for us here in Hampshire and the Isle of Wight. So with that, can I just thank our colleague Alec today for being so generous with his time. I think there is huge amounts that we will take from this, and we will reconnect with him to take up that invitation of continued engagement, so that we can fully utilise the support from the national team as this policy area goes forward. So thank you again for coming to today's Spark session. If you do want to offer some feedback, we absolutely listen. We take it on board for the future sessions. And as always, grateful for any future topics. So have a lovely rest of the day, and thank you again for coming to our second Spark session.